Hello, my name is Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to talk with you about incontinence or loss of urine in men. In this 7-minute video, I will discuss how common it is, what are the causes of incontinence in men, and what treatment is available for this condition that significantly impacts a man's quality of life. Incontinence is the involuntary loss of urine that affects about 3.5 million American men. It is not a normal sign or aspect of aging. And the good news is that help is available. Almost everyone who has a problem of urinary incontinence can be helped or cured of the problem. There are 3 types of urinary incontinence in men. The first is referred to as stress incontinence, the loss of urine with coughing and sneezing. The second is urge incontinence, that is the tremendous desire to urinate immediately, and when the urge comes, it comes so quickly that the man can't reach the toilet in a timely fashion to empty his bladder. And the third is called mixed incontinence, which is a combination of stress and urge incontinence. So what are the causes of urinary incontinence in men? It can be due to an enlarged prostate. It can be due to diabetes or Parkinson's disease. One of the most common causes of incontinence in older men is following surgery on the prostate gland, where the muscles that control urination are injured or are divided. And then there are men who have incontinence for reasons we don't quite understand. So what are some of the ways to manage incontinence in men? First of all, you can space out or decrease the amount of fluid intake. You can decrease the amount of fluid you take before going to bed at night, especially if you have incontinence in the evening. There are also bladder irritants that make a man go to the bathroom more frequently. The most common culprits are caffeine, alcohol, spicy food, tea, soda. These liquids can significantly irritate the bladder and make a man go to the bathroom more frequently. If you feel that these fluids are part of the problem, you can cut back on these suspected trigger fluids for a week to 10 days and see if it makes a difference. You can also train your bladder by trying to expand the amount of time between urinating. You can start out going to the bathroom every half hour, 45 minutes, and slowly increase the time interval by using a watch to see if you can slowly get up over several weeks or months period of time from 30 minutes to 120 minutes. Your goal should be to have 3 to 4 hours between urges, and this is accomplished by retraining your bladder. There are also exercises called Kegel exercises, named after the doctor who identified the muscles in the pelvis that could be exercised and strengthened to prevent urinary incontinence. In order to find the right muscle, these are the same muscles that you would contract to help prevent passing of gas from your rectum. You can tense and hold these muscles for 3 to 5 seconds. You need to do this 4 to 5 times a day with 10 repetitions each, and over a period of several months you can strengthen the muscles in your pelvis that will help control the problem of incontinence. Then there's the solution by using pads, patty liners, and diapers. Men really don't like the idea of getting pads or disposable undergarments. However, they do prevent soiling of the clothing and embarrassment, and it does protect the skin from irritation, and it also blocks the foul-smelling odor of urine on the clothing. These garments can help a man regain his confidence. For severe urinary incontinence, there are absorbent guards or disposable underwear. There are drip collectors that go around the penis, and these are designed for light or moderate leaking. Other devices include an external catheter or condom catheter, which is a condom which is rolled onto the penis that has an opening at the tip that goes to a collector bag worn on the leg. And then for men who have trouble emptying their bladder, they can catheterize themselves with a small tube every 4 to 6 hours to keep their bladder empty. There are numerous medications that help relax the bladder to prevent inappropriate contractions of the bladder. There are also drugs used to help shrink the prostate gland if that is the problem. Finally, there are surgical procedures. One is a male sling operation, where through a small incision between the rectum and the scrotum, a sling is placed against the urethra that helps to compress the urethra and control stress incontinence. There is also an artificial urinary sphincter where a cuff is placed around the urethra attached to a pump in the scrotum. When the man wishes to go to the bathroom, he squeezes the small pump in the scrotum, which opens up the cuff around the urethra and allows the man to go to the restroom. So in summary, incontinence in men is a common problem that affects millions of American men, and the bottom line is incontinence is almost always treatable, and you don't have to depend on Depends. I hope you have found this information useful. If you would like more information, please go to my website at www.neilbaum.com or contact me at my office at 504-891-8454. Thank you.